back from, I want us to get back into the order of draw. I know on Sunday, actually, Miss Brianna, when you did leave on Sunday, I did start going into the order of draw a little bit more in this in detail to try to get you guys familiar with the most common tests that we're going to use in the order of draw for you to be familiar with. And because of real life circumstances, you already know thyroid goes in a tiger top tube. Okay, so with that being said, guys, if you have your blood tube papers in front of you, or your book, whichever one you want to have, if you can go ahead and get that back out, because I want to resume where we left off. And if I'm not mistaken, I think that I left off on getting into, oh, okay, thank you, Miss Brianna. But I want to go ahead and get back into the green. I think I stopped before I got into the green top tube. But before I really just go over that, I do want to, you know, just reiterate, because that was Sunday. So I want to just get us kind of more refreshed. Give me 1 second. I have a whiteboard that I'm about to share. On Saturday, when we come in, I do have a Kahoot game that it's for fun. You know, it's to check your knowledge. It's not for a particular grade. It's just your participation matters. But I do have a Kahoot game that involves your phone and us, you know, kind of checking the knowledge of everyone. And it'll be from what we've already learned from the beginning till now. And I think that it's fun, and most schools use it. And it's just to really just help, you know, each other out, as far as not help each other, but to help you as far as your knowledge base. Now, with this being said, this is my whiteboard for, as I call it, the order of draw. Again, I don't know if you want to take pictures or a screenshot of it. I do not on purpose want you to have all of these things that you have to study from. Remember that. So you have the paper in front of you, you have this and that, and remember how I explained to you towards the end. I will try to help you come up with a more organized way to where you can have all the information that we learn within your course all on one page, front and back. Okay, so with that being said, I do have my paper here that you have. I do have page 2. I'll flip it over, you know, as I actually get to that point. But I also have little boxes here to kind of, for me, I feel like that's what the order of draw is kind of separated in. Give me 1 minute, because I want to. Make sure you all can kind of see, because depending on what your screen you're looking at, phone, tablet, computer. All right, so with this being said, we do have our order of draw. You guys remember that the reason why there is an order of draw is because per CLSI standards, we need to go in that order. And if we do not go in that order, we can jeopardize the contamination of mixing additive with the blood before it's time. You guys remember, on each end of the needle is really a needle. One side is the needle that goes into someone's vein. The other side is the needle that punctures the blood tube. So if we go out of the order of draw, remember, it's a vacuum motion, that tube. So whatever's in that tube versus, you know, anything else, it could just suck in the needle. And then as we doing our tube exchange, the wrong additive before time can be mixing with the tube that it shouldn't be mixed with. And so you can cause your patient to have false high or false low type of results that can result in misdiagnosis of your patient. Okay, So just keep that in mind. At the end of the day, you know, you just do your best. And as you get better and better, it'll get better and better. But like I said, and on Saturday, we will go over it again. Once you actually get your equipment out and you get the tubes that you need, go ahead and put them in the order of draw, so you'll already have them in that order, okay? So with that being said, we have first in the order of draw, if you were to have it ordered, remember, we have our aerobic and our anaerobic. Okay, now we know from our medical terminology that one has oxygen, one doesn't have oxygen. We need both of them, okay, for adults for sure. So just keep that in mind, okay? Now, when we move on to the next order of draw, which is our first blood tube, remember, it's light blue in color. The additive in it is sodium citrate. If you can just remember citrate, that's the best of your ability. That's what you're going to see on everything else, okay? Citrate. Remember, we invert it 3 to 5 times. This is the tube that's inverted the least of them all. The most common test is PT/INR and PTT. Remember, we talked about that. So I'm gonna just go ahead and reiterate and go over what I went over already, just to be, you know, it doesn't hurt. Okay, so I have my separate box. So for example, if you're making your notes, rather you're going to use note cards or whatever you want to do that you know that can help you to remember, then you have a separate note card, or you have your spot on your note sheet where you did your blood cultures, aerobic, anaerobic, and then next underneath there, if you want to be color coded. Oh, I kind of froze. Hopefully my internet not starting cuckoo. If you want to color code your notes, you can write in blue, but however you want to do it. But light blue top tube, sodium citrate, it's inverted 3 to 5 times. Inversion means we are figure eighting, moving our tube from side to side in a figure 8 motion 3 to 5 times. The most common test is PT/INR and PTT. Remember, the background towards this PT/INR, PTT is that someone is on blood thinners and the doctor is probably, I mean, it's not probably, but the doctor is ordering these tests to make sure that the patient's blood is therapeutic enough. Is it bleeding? Is it too thin? Is it not bleeding enough because it's clotted? It's measuring the person's bleeding time of their blood. That's what PT/INR and PTT is, okay? Remember, if you do see PT/INR, PTT, and that means you're picking up your light blue top tube, 10 times out of 10, that person is on blood thinners, okay? Light blue top tube, sodium citrate, invert 3 to 5 times. PT/INR, PTT is your most common test you're going to see. You are going to see it, okay? Now, moving right underneath, next in the order of draw, we have our red top tube, okay? So according to my little, you know, box that I made, remember, the red top tube has no additive, okay? But it is a serum tube. It is a clot activator tube. So when we, on Saturday, when you see, once we get our live blood, you will see when you, even though the red top, remember, we don't have to invert it because it's nothing to invert it with. We're only inverting it to mix the blood with the additive. And the red top tube doesn't have the additive. But if you ever had to use it in real life, you will be able to see that the blood is liquidy, but you have to let it sit for 30 minutes. Once it sits straight up for 30 minutes, it's going to be clotted, okay? That tube is made to clot. It's supposed to clot, okay? Then when we go over to its neighbors, which is what you're going to really see in real life, I don't want to confuse you guys. And why is CLSI still advertising the red top tube when we use the gold top or the tiger top all the time? I don't know. But Just keep in mind that the gold top and the tiger top is a serum tube. It's SST. The additive that's in those tubes is a gel additive, which is the SST. Those are still made to clot because they're all serum tubes, okay? So when you look on your paper, like the paper that I have here, you see that our red top, marble, and gold top, they are supposed to clot. Clotting time required, 30 minutes versus 60 minutes. The difference between the 60 minutes is because, remember, our red top has no additive, so it's going to have to sit a little longer to clot. Our marble top and gold top does have the gel additive, which is SST. It only needs to sit for 30 minutes before we spin it in the machine. I will go over the machine and go over that particular entity again. But if you can remember, from your serum tubes, they are made to clot. The red tube has no additive. The gold and marble top tube has an additive, which is SST, okay? You invert the gold and the tiger top 5 times, okay? So you do invert them, the gold and the tiger top, because it has that gel, okay? The red top, you don't need to invert it because it has nothing in there. When we talk about our most common tests, remember we went over it. We went over chemistry profile. Chemistry profile, when you wrote down on your 2-page paper, like over here in this area where it says chemistry profile, I told you guys to write CMP/BMP. That stands for complete metabolic panel versus basic metabolic panel. But both of them together is a chemistry profile. That is a most common test that you will see in your tiger top and gold top tubes, your SST tubes. Moving on next, for the most common test, remember I did tell you guys to circle hepatic panel. That's the word for liver. It's the same thing, hepatic panel, liver panel. So hopefully you did write that down so you can remember. On your, they're gonna have it's different versions to the test. Whether you get the version that say liver panel or whether you get the version that say hepatic panel, they're the same thing, okay? So that's why I want you to write down hepatic panel, but just write down liver next to hepatic. But that is the second most common test in the SST tube. The third most common test in the SST tube is your lipid panel. And I also instructed you guys to write cholesterol because that's the same thing. Okay. Typically, for sure, cholesterol levels are taken on fasting because remember, you can't go and just had, short stop. Y'all remember short stop? We don't have short stop anymore, but let's just say you didn't have you just went and had checkers, or you had some type of fried food, and then you went to see your doctor, and then they ordered blood tests, a cholesterol lipid panel. Typically, when they order that, it's going to be fasting because it's supposed to be, at your most vulnerable state without eating. So if you do get a question that says, what test is mostly done on fasting or will be done on fasting, hopefully you choose cholesterol. So if you want to write that on your notes, that for sure lipid/cholesterol panel is done on fasting, you can write that down, okay? So our serum tubes, which is next in the order of draw after the light blue top tubes, they are clotted tubes. They are made to clot, okay? You got your red top tube with no additive, but you got your marble and gold top tube, which is what you're going to see in real life and you're going to use, okay? You don't just automatically pick up the red top tube. Everybody just pick up the gold or the marble, okay? Those are SST tubes, serum separator tubes. We do invert them 5 times to ensure mixture with that gel substance it has in there. We do let it clot, but I'll talk about the clotting part more on Saturday. But the most common test that you will see in your SST tubes is chemistry panels, lipid panel, which is cholesterol panel, and hepatic panels, okay? And as you can see that we are already learned, thyroid studies is also done from an SST. If you want to be an overachiever, and go ahead and put that down so you can get that going in real life. You can do that if you want to. But remember, if thyroid studies were checked, anything with thyroid were checked on the requisition, it will tell you the tube that it goes in. But if you want to get yourself used to knowing what it is now, you will know that anything dealing with the thyroid will go in your SST tubes. Okay. So our serum tubes, no matter if it's red, gold, or tiger, they are made to clot. Okay. But our red top tube has no additive. Our gold and tiger top tube has the additive of SST, and we invert those 5 times. And our most common test is our chemistry profile, hepatic panel, and lipid panel. Okay. So that's where I had stopped at on Sunday. So moving forward, I want to jump into our green top tubes. So green top is next in the order of draw. The additive in our green top is heparin. When you look at your paper that you have, that I gave you, as I'm showing on my whiteboard, you'll see that there's a light green and there's a dark green. They're kind of like the same thing too. Okay. It's just the old fashioned was light green, so they're just moving away from the dark. The old fashioned was dark green. So basically they're just slowly moving away from the dark green and introducing a light green, but they're both are heparin tubes. Okay, as you can see, lithium heparin, they're both are heparin tubes. Okay, so if I ask you what comes next after the serum tubes in the order of draw, you'll say your green top tube. You don't have to say light or dark. You could just say green. And the additive is heparin. We invert those tubes 8 times. The way that I remember after the light blue and the serum tubes, the tubes that follow next all are inverted 8 times, and we'll talk about it. Okay, so I don't want you to freak out like, oh my God, how am I going to remember all this inversion? And then on top of that, after I finish the auto draw, I'm going to actually show you how to invert them if you had a tube of each entity. If you had a tube that was inverted, that's supposed to be inverted 3 to 4 times, a tube that's supposed to be inverted 5 times, and a tube that's supposed to be 8 times. You're probably like, that's going to take a lot of time to invert this one 3 to 4 times, invert this one 5 times, and invert these 8 times. So typically, you're going to invert them all together. You put all of them in your hand and invert them. The fact of the matter is, long as you don't under invert them, you can over invert them. So for example, if you have a light blue top tube and a tiger top and a green top tube, we got one that's 3 to 4 times, one that's 5 times, one that's 8 times. Basically, you're going to invert them all 8 times. You're not under inverting. It's okay to over invert them, because remember, we're just ensuring that the additive mixed with the blood. So it's okay to overdo it. Okay, makes sense? So that's how you're going to do it. Invert it, all of them 8 times. Okay, if you only have a light blue top tube, okay, cool. So you just invert that 3 to 4 times and be done with it. Okay, so it's okay to invert them all together. Just know that you need to make sure that you do enough inverting. Just don't under invert. Okay, so for example, you have back again, you have that blue top, that tiger top, and a green top. Let's just say you only invert all of them 5 times. Well, technically the blue top tube and the tiger top tube is okay, but you under inverted the green top tube because it should be inverted 8 times. Okay, I just wanted to be sure you all understand that. So you can invert them together, but just go ahead and invert them the full 8 times and be done. Okay, so on our green, our heparin tube is inverted 8 times. The most common test in the green top tube, okay, Please, I don't mean no harm. I'm gonna try to explain it in the best way. Do you guys see that right here highlighted in yellow on our sheet that you have, and it says preferred for all stat general chemistry requests? Then you see underneath it, chemistry profile. Oh, that looks familiar. You see lipid profile. Oh, that looks familiar. Hepatic panel. Oh, that looks familiar to you, don't it? So what this is saying is everything that any test, most tests that goes in your SST tube can go in your green top tube. These tests, the reason why they look familiar, they can go in your green top tube. But the only reason why you would draw it in the green top tube is because the doctor needs it right away. It's a stat lab. Okay, so I don't know if you all remember, I can't even remember if it's on Quest or LabCorp because you have both. One of the requisitions say gel, and I was waiting for somebody to ask that question, but one of the requisitions say gel. But if you paid attention, if you took pictures of the real tubes, like what we was going over on Sunday, remember the SST tubes have gel in it. Remember the green top tubes have gel in it too. Did you remember that? So with that being said, the SST tubes are for serum. They are serum tubes. They are made to clot. You do a chemistry profile, lipid panel, hepatic panel, and whatever else. But your green top tube, which is your heparin tube, also have a gel in it that is heparin, but they are made to be tested right away. So the same test that goes in your SST tubes can go in your green top tube. So if I was the actual medical lab technician, and you brought the green tubes to me to be resulted, I know that some of those must be stat. Okay, tell me if I lost you. So the green top tube is not a SST tube, it's a heparin tube. But the same test that goes in the green, the marble and gold top tube, the SST tube can go in the green, but it's only because it's stat immediately, ASAP. So when you look at my little four-way cube here that talks about the green tubes, you'll see it says any lab test that is ordered stat. Now, when we moving forward, I told you I was going to give you 3 most common tests. Now, even though any test that is stat that you could put in a green top tube is the same as the gold, you just know that it's stat labs. But also, if the doctor orders an ammonia level will go in a green top tube, and ammonia will be one of the ones that we start talking about here before we leave tonight with special collections. Ammonia goes on ice. So if I ask you just right off the rip right now, give me one test that goes on ice. You know, one lab test that goes on ice. Hopefully you could say ammonia. Okay, what color top tube it goes in is green. And it kind of fits you because that will be stat. It has to be on ice. You can't keep it on ice all day, right? So that means as soon as you draw it, you keep it on ice, and it needs to go to the lab right away. So in a way, it's still a stat lab. So I'm just trying to get you to remember anything that's immediately or ASAP, predominantly of the time goes in a green top tube. Okay. And also, as you can see, therapeutic drug monitoring, it goes in a green top tube. And how would you know what's a therapeutic drug monitoring? It'll be checked. Okay, it'll be checked and it'll tell you that it's therapeutic drug monitoring, and you'll be able to know. But if I can tell you to maybe put this to the bottom, but remember these 2, that will be perfect. If you can remember, the common test in a green top tube is any chemistry test that's ordered stat, the same as the SST, but it's ordered right away. And then your ammonia test, and that goes on ice. Okay. Did I lose anyone so far? Does anything not make sense? Okay. Moving right along to our next order of draw, which is our purple or lavender top tube. The reason why I say purple or lavender is because some of your requisitions will have a P for purple, or it'll have a PUR for purple, or it may have an L for lavender, or it may have LAV for lavender. Okay, so just keep that in mind. And also, I can't remember if it was this class, but some people, a person or a few people have asked me, well, why can't L? How you know that's not for light blue? It's not going to be labeled that way. If it is, it'll be LB for light blue. Okay. So just keep that in mind. And as you start knowing and getting familiar, the most common tests, if you have a PT, INR, PTT, and it has a L, you would know, or if it has LAV, you will know what's the difference, because by now you should know that PT, INR, and PTT is in a light blue top tube. That's it. That's the main test for that blue tube. Okay, so purple or lavender. The additive in our purple top tubes is EDTA. That's what you remember it by. I did tell you that EDTA actually stands for this big long E word, but no one ever uses it. Everything will be accustomed to the word, the letters EDTA. That is the additive that's in your purple top tube or lavender top tube, okay? As you can see, that tube is also inverted 8 times, okay? Inverted 8 times. The most common test for you to remember is CBC. And if you want to know what CBC stands for, it stands for complete blood count. So when a doctor wants to know what's actually going on with you, how, you know, it can be determined if you're anemic, if your blood levels are low, if you need blood transfusion and things of that nature. CBC, complete blood count. You're not in a microbiology major or a lab major, so it's okay not to really exactly know what CBC. You're not a doctor, but what you do need to know is CBC is a common test that goes in your purple or lavender top tube, okay? Next, you see I have HbA1c. That stands for hemoglobin A1c. That is a most common test in that purple top tube. That's how a doctor would know if a person has been diabetic for a minute. You know, that result will let someone know how someone's blood sugar has been running, like in a 3-month period. Not the blood glucose sticks that we do that you get back rapid, that's point of care testing, but drawing your blood to just kind of see where your levels stand, and it basically checks for diabetics. So people who have a hemoglobin A1c test, either you're getting that done every year with your physical, or you are a diabetic and the doctor have you go to the lab every 3 months to check your A1c. Okay, if you hear A1c, people just say that's short, but the whole word is hemoglobin A1c. But what you see here is the abbreviations for it, just like on your sheet. It still say HbA1c. That's your most common test in your lavender or blue top tube. Next, it'll be your SED rate. Okay, that is a most common test in your purple or lavender top tube. Okay. I have H H right here. It's not, let me go ahead and move that down to the side. You can write it down if you want, but it's not as important for you to memorize like those other three. And H&H stands for hemoglobin and hematocrit, which you do see it on your paper, H&H. But H&H is done within a CBC because that is a complete blood count. So if someone has just a separate order for H&H, that's because the doctor is solely wanting to just know about their hemoglobin and hematocrit level. But if they want a full panel of their blood level, then they'll do a CBC. So that's why a CBC is most important. It's most common. Hemoglobin A1C is most common in diabetics or in your physical. I get a hemoglobin A1C done every year. I'm not a diabetic, thank God, but I do get one every year. So that is something that's included in your yearly physical labs. And SAID rate is most common also, okay? So that's our lavender/purple top tube. Now, as you can see, I have pink written up there. Let me turn my sheet around. Okay, so I went to page 2 on our sheet, and you'll see at the top here is our pink top tube. The reason why I have pink and lavender underneath each other, because as you can see, the additive that's in the pink is also EDTA, okay? We still invert those 8 times. No clotting time required, just like the green. No clotting time required. You don't have to let it sit to clot. We just automatically put it in the spinner machine. But what I want to add is the pink. A CBC can't go on the pink. You're probably thinking like, oh my God, this is one of those ones where all of these multiple tubes mean the same thing. Even though the pink has EDTA, we inverted 8 times, you will only use the pink if you worked in a blood bank or a plasma center, or if you was a phlebotomist in the hospital and you have to draw a pink. That's because the doctor is typing, screening somebody, or doing an antibody screen, cross match, meaning that they're trying to see what blood type someone is, because someone is probably finna start to get or may need a blood transfusion. So they want to see what blood type you are. They want to type and screen you, mean they're trying to see what blood type you are. Cross match mean they're trying to see what other blood genres is okay for you to get if you need a transfusion. They're trying to match you to any other blood types out there. Okay, so with that being said, if you ever have to draw a pink top tube, it is solely for the blood bank. Okay, so like our papers say, let me bring it down a little bit. Our papers say blood bank armbands must be completed and attached to the pink top. So I'm not going to get into the glass red top because they don't use it no more. But the type and screen cross match is requested. So if I ask you what comes to mind, if you have a pink top tube in your hand, hopefully you will say, oh, that's used for blood banking purposes to see what blood type someone is. Oh, we do invert that one 8 times too. Oh, that has EDTA in it too. Okay, so just keep in mind, even though I paired it up with your lavender and pink, I only paired it up because it has the same EDTA. So just a bust your brain for a minute. I mean, not bust your brain, but let's just say you had orders for a PTT, INR. Let's just say you had orders for stat labs, and let's just say you had orders for a CBC, and then you had orders to draw somebody blood to cross match them because they may need a transfusion later. You're probably like, ooh, which order am I going to do? So you still do your blue because your blue is first. Then next, because you didn't have an SST, you did have chemistries, but remember I said stat. So then you have your green top tube that will come next anyway after the blue top tube. So now you have your purple and lavender. So you probably like, oh my God, which one I'll draw first? So I want to let you know they have the same additive. So it doesn't matter which one of these you draw first, okay? It doesn't matter. You could draw the pink first or the blue, the pink first or the purple first, or the purple first or the pink. It doesn't matter because they have the same additive, okay? Now, whatever comes after them, you draw after them. So you will draw this. It doesn't matter which one you draw first, as long as you draw them in the order that they're supposed to be in the EDTA in your order, okay? Makes sense? Okay, so our purple and lavender top tube has EDTA in it. Our pink top tube also has EDTA additive. We still invert them 8 times, okay? The most common test in our purple top or lavender top is CBC, hemoglobin A1C, and SED rate. Remember, our pink top tube is predominantly used for blood banking purposes, to type and screen someone, cross-match someone. If you are tested or on your national test or even quizzed by me, long as you know that that is used for the blood bank, okay? And just to go a little bit further, you'll know, oh, this to see, what blood type somebody is. And this also to see what other bloods is compatible to them if they need a blood transfusion, okay? And they're short on blood supply or whatever the case may be. But just know that's what the pink top tube go for, okay? All right. Moving forward, your next quiz is the order of draw quiz. So I do want to be sure that you understand, and then just let me know if you have any questions. Now, moving last to the last main order of draw. If you can visualize my board, my little poster board in our training room, you see it's the blood cultures, it's the serum tubes, then you have your green top tubes for your heparin, then you have your purple tube for your EDTA, and then last is our gray top tube. Remember, gray should stick out because we saw that there's a gray tube for urine, but there's also a gray tube for blood. So remember the difference between the two. Always look at the labels. So our green top tube additive is oxalate. But as you can see on your form, the additive is like 4 words. It's sodium fluoride potassium oxalate. And remember, if you remember looking at the label on the gray top, it says that on the gray top. But just know, if you want to cut it for short, that's your oxalate tube. That's your gray top tube. That is also inverted 8 times. So remember, if you close your eyes and think about the color tubes that come after the serum tubes, the rest of them is inverted 8 times, okay? Your SST 5 times, your light blue 3 to 4 times. No matter if you want to test yourself going forward or going backwards in the order of draw, just try to get yourself, familiarized with the inversions, because you will see the inversions again, okay? So green, purple, and gray is 8 times. If you want to throw the pink in there, it's still 8 times like the purple is, okay? So our gray top tube is oxalate for the additive. We invert it 8 times. So when we go to the most common test for our gray top tube, is, even though it's not on your paper here, which I don't know why it's not, but anyway, this is adequate information. A fasting glucose level will be in the gray top tube, okay? And if you want to take out your requisitions and find glucose, you'll see it says GRY for gray, or it'll say GY for gray. Whatever the case may be, it stands for gray, okay? Fasting glucose level. Also, another most common test, which you do see on your sheet, and there's only one that you see. It is a lactic acid, and as you can see, lactic acid also goes on ice. So if you want to now say, okay, oh, she already said 2 that go on ice. That's ammonia and lactic acid. But just remember, ammonia is in the green top tube versus lactic acid being in the gray top tube. But it still goes on ice. Fasting glucose level and lactic acid are the main, most common two to remember in the gray top tube. Like I said, the order of draw is a big segment within phlebotomy. If you do start off by working in a blood bank or a plasma center, the order of draw is not your cup of tea because you're not a full lab. You are a blood donation center. So your tubes that you will see is purple and gray. I'm sorry, purple and pink. Pink is for blood bank, but the reason why I add purple is because you're giving blood, and sometimes the medical doctor that's at that particular blood bank may want to order a CBC on you to check your blood count, to make sure, to go in detail, make sure you're not anemic, make sure your iron level isn't low, make sure your blood count isn't low. And so they typically will order a purple top. So in a blood bank or a plasma center, you would just get used to seeing purple and pink, but it's more so pink all the time, okay? But purple, you will see it, but you will not have to worry about the order of draw in a plasma or a blood bank system, facility, okay? Now, do I have any questions regarding the order of draw at this moment? And if this helped you to kind of separate your order of draw so you can kind of start getting yourself familiarized with the order of draw, let me know. But this is typically the order of draw condensed. And honestly, it's no other way for me to tell you. The only way that I can think about is basically going over it again so you can get used to hearing it. And like I said, the tests commonly associated with these color top tubes, obviously I did not say all of them, but ain't no way as a new phlebotomist, I mean, it could be a way if you just study it, but in the 3 weeks time, it's difficult or challenging to memorize all these. But as basic fundamentals, what I gave you is what you need to know, because that's the knowledge that you're going to be tested on. Okay, so no questions? Okay, I just want to be sure there's no questions, but what I would like to do is unshare my whiteboard, and I want to talk to you and let you see something. So right here, you see I have an image of examples of tests requiring specimens to be chilled. And as you can see, I highlighted in yellow what you're going to be familiar with, okay? Ammonia goes on ice, but ammonia goes in a green top tube. Lactic acid goes on ice, but it goes in a gray top tube, okay? All the rest of these, they are on there. But as far as you to know the basic fundamentals of what you need to know, it's those two. And then also, let me show you this. Okay, so I want to show you this because as you can see, these are called microtainer blood tubes. Microtainer, 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 microtainer. But as you can notice, they are similar in color to the bigger blood vacutainer tubes. These are done for pediatrics. These are done for infants. So for example, the same test that we've been talking about that goes in the regular vacutainers are the same tests that go in the microtainers for infants. The reason why they are microtainers, and I'm going to get into it in just a minute, is remember when we did our capillary puncture or dermal puncture, I explained to you that in infants, we don't stick their fingers, we stick their heels. So with that being said, if they don't get their blood because they're so tiny, most of the time they don't get their venipunctures, okay, until they're at least over 1 year old, unless they're real ill and they need an IV. So the nurses and the doctors would get blood from the IV line. But for the most part, their heels are stuck with the capillary puncture, and you'll take the top off of these microtainers and let the blood drop in the vacutainer, in the microtainers. As you can see, you see the order here. I'm not going to confuse you, but there is no particular order for microtainers. The only thing that per CLSI standards, when it comes to microtainers, if you do have a CBC or hemoglobin A1C or SED rate that goes in this purple or lavender top tube, they ask that it's done first, and then all the rest of them, it doesn't matter what order you do them in. You're probably saying, well, why? You know, they just confusing us, you know? But the reason why is that the blood vacutainers, you're using a needle to go in someone's vein. So you have to go in the order of draw, like I said, so you don't cross-contaminate the additive. But in this case, the blood is dropping from the capillary puncture of the heel into the microtainer. So in that case, there's no need for order of draw. There's no need to cross-contaminate because the blood is just dropping into the vacutainers, and they are really micro. So it's just maybe it could be at least 10 drops of blood or so, with the hopes that the baby heel is bleeding well. And that's why it's very important to warm the baby's heel, because if it's cold, like I explained to you, it'll be hard for the blood to drop, or to take longer for the blood to drop. So I do not have real microtainers to show you. They're really hard to get. So therefore, I just have to go by and show you guys the image. These are exactly how the microtainers look, okay, for the infants, okay? The same test would go in them. It's just that you would have to draw the purple top first, and then the rest of them, it doesn't matter any order you get, okay? And this is in capillary puncture, okay? Okay. Give me 1 second. Talk to me if you have any questions. Okay. Okay, this is what I want to show you all. And this is also in your book. The pages that I told you all for the capillary punctures and the dermal puncture, it tells you about the heel to the infants. And so I just want to kind of put some direct attention on what I know that you need to know and remember, even for real life, is that right here, this is a diagram or a image of a foot, and it should be an infant's foot. These are pointers to remember when we do a capillary puncture on an infant foot. Remember, infants are birth to 12 months, years of age. I know that we know that, but I do want to make sure that you hear that from me. Birth to 12 months, years of age. When we do a capillary puncture on a heel, it's the same difference of what we did on our fingers. It's just that now you have a heel. So you're probably like, oh, I'm gonna be nervous to stick a baby in this foot, you know, but you still use a lancet, whatever lancets your facility carry. Remember the lancet you see right here at the bottom, the lancet should be no longer than 2.0 millimeters for your infant. That means the depth that it's gonna go. You don't wanna stick the infant you know, with a bigger depth and penetrate the bone. We don't want to do that, okay? So for infants, remember, the depth of that lancet needs to be at 2.0 millimeters, okay? We warm the infant's foot because typically 10 times out of 10, or I'm gonna say 8 times out of 10, most infant foots are cool at touch. And if it's cool at touch, you can warm it up with your hand. That may take a few seconds or a minute or two, or your facility will have a warming pad where you can activate the warming pad, break it up or whatever, however you do it, and place it on the infant's heel so you can warm it up. I would warm up both because just like anything else, when you go from arm to arm, you want to be ready. You just want to have all access. If this heel don't do right for whatever reason, you want to go to the next heel. So make sure you warm them both up, okay? We still using that 70% isopropyl alcohol. I don't care that it's the foot. We still using it. But just like the finger and the venipuncture, if alcohol isn't available or you were told not to use alcohol, you still have to use some type of aseptic technique. So then that's when you go to the chlorhexidine gluconate, or another example is the chloroprep, okay? We still let it air dry. Per CLSI standards, we have to let the alcohol air dry. We don't blow on it. We don't wave on it. We don't take a gauze and wipe it dry. We let it air dry, okay? And then we go ahead and puncture the infant's heel. Just like the capillary punctures in the finger, we still tap away, or as they call it, wipe away the first drop of blood. It's still done in the heel. Okay, don't put pressure on it because remember, it's little capillary blood. So if you put a lot of pressure on it, you can cause hemostasis already, meaning the blood is already stopped. So that's how come we want to go ahead and just tap the blood away, but you will still do it in the heel. Wipe away the first drop of blood. Now, as you can see, the heel of the foot, the orange areas is where we will stick our babies in the heel, okay? So basically, we will stick the lateral medial area of the heel, meaning lateral means side and medial means middle, okay? So we will stick the side middle area of the heel. We don't never stick the center of the heel, if that makes sense. This is the center, but then we have two sides and you just stick it in the middle area, but on the side. You will see that again. So if I ask you, okay, are you comfortable? We're running clinic today. I got babies coming in. Today is baby day. And so we're going to be sticking their heels. Are you comfortable with sticking the infant heels? And if I ask you, okay, where are you sticking the infant heels? And you say on the side, in the middle, and that's fine, that's feasible. But on your test or on your quiz, it's going to be medical terms and it's going to say lateral medial area, okay? And that's where you stick your baby on the heel, okay? Do I have any questions regarding the capillary punctures of an infant's foot? Remember, birth to 12 months. Toddlers are typically supposed to be over a year. So that means when you come to your toddler, if you're over a year, you can now stick them in their fingers, okay? Remember, we're only sticking the third and fourth finger. We're not sticking the thumb, we're not sticking the index finger, and we're not sticking the pinkies. Only the third and fourth fingers, okay? The third digit, fourth digit. It doesn't matter if it's your non-dominant hand or your dominant hand. It doesn't matter unless your patient tell you, oh, baby, just stick this hand. I do knitting with this hand and I use it a lot, you know. So whatever, if your patient tells you, then, you know, just give them their wish. But it doesn't matter in actuality which hand, long as it's the third and fourth fingers, okay? And the lateral medial parts of the heel for the infant, okay? Any other questions? Ladies and gentlemen, everybody good? Okay. So I want to go ahead and move forward and start talking about special collections that you probably heard me mention over and over and over and over and over again. So it does come with a video. That this video will be about 8 minutes or so long. I will double check here in a minute once I bring it up. But I did just look at an image that I meant to share with you all on Tuesday. And you do, I mean, you have so much studying material that I do give you. I know that I do give you a lot, but I do want to be sure that I hit the points that I want you to make sure that you be familiar at, because when I hit the points, those are the points that I need you to be familiar with and get yourself comfortable with, okay, confident in. And so we already talked about before labeling our tubes, and we will label our tubes on Saturday. But just remember that after you invert your tube, we want to be sure to label our tube. What goes on the label is for sure the patient's first and last name, the patient's ID, like medical record, the date, the time, and the initials of you. The initials of the phlebotomist needs to go on the label. So for example, in this day and time, you don't have to write anything, anymore, because everything is, we have so many things that's computerized and that's electronic. So your lab, the label will print out, okay? All the labels will print out. If you're drawing 4 tubes, that's because the orders were in the system. So the computer knows how many labels to print out. And then if you had urine, then it'll print out those urine tubes. So you just need to be sure, you need to be mindful to pay attention to make sure you put your labels on the proper blood tube and urine container that it's supposed to go on. But when you do put it on there, the patient does verify that you have labeled the specimen with his or her name. But you do need to go and then write your WC. For me, when that is your pain, I write my WC. I write the date and the time. Sometimes the labels will already come with the date because it'll be accustomed to when the patient was in there when you print out the labels, but they don't know the time. So you would write the time. So it's very important to put the date and the time. Now this last one, I would just don't look at it, but because it's already the time that you put on there is the time that it's been collected. So long as the date and the time and your initials is on there, the patient's first and last name and the patient's medical record number that matches up, for the lab, be sure that what goes on your label. You will be tested, with that. It's very important. And if you look at the label, it all makes sense, okay? You need to have your patient's name. You also need to have your patient's ID number. And typically the date of birth is going to be on there as well. I don't know why it's not on here, but the date of birth is going to be on there. But what I need you to make sure that you remember is that your initials, the date, and the time that the specimen was collected needs to be on that label. So typically that will be what you write on the label, okay, in most labs. But the name, the date of birth, and the patient's ID, medical record number, it will already be printed on the label, okay? So be mindful that's what's on your label. And you do have it's like 4 pages in your folder. I think one talks about safety, one talks about the actual venipuncture, the supplies you need, one talks about labeling, and I think one talks about the requisition. Safety, venipuncture, something like that. But you do have a paper that talks about the labeling. And it shows you the actual blood tube and where the label go, which is what, we will also do on Saturday. But just keep in mind that labeling is very important. You want to be sure that you label your tubes appropriately and make sure that you put your initials, the phlebotomist initials, who drew and collected the blood, and the date and the time. Okay. All right, moving forward. Let me prepare my video. It's 7:40. All right, this is a little under 9 minutes, about 8 minutes and 51 seconds. And I'm gonna let the video play as I normally do. And I do have a whiteboard that I'm gonna show after the video, and I will be able to go in detail of everything that is talked about in the video. And this is considered special collections, meaning that this is any type of specimens that is collected in a special way, meaning it's not only just identifying your patient, preparing them with interview questions, drawing their blood, inverting it, labeling a tube, let them go. This means that, oh my God, it's a little extra special stuff. Okay, so I do want you guys to be prepared for it.
We're looking at special blood collection procedures. Let's begin with bilirubin. What is bilirubin? Bilirubin is described as a yellow-orange substance, which results from the breakdown of hemoglobin. Now, bilirubin is a waste product from the breakdown of old red blood cells, which is processed by the liver for removal from the body. Abnormally high bilirubin levels are often indicative of liver disease. The result is jaundice, yellow skin, and yellow in the white of the eyes. Now, what would be the purpose of this test? Well, one, we will be determining liver disease. Another would determine blockage in the bile duct. And another is neonatal jaundice. And again, all these are all associated with issues with the liver. And some of the precautions we need to take when drawing this type of blood sample or checking for high bilirubin levels, we need to minimize exposure to light. That is referring to the blood sample itself. When we are done collecting the blood, we need to minimize exposure to the light. This is a sensitive test, and we need to make sure that we keep it light exposure to the bare minimum. And by doing so, we might be using some light blocking amber colored containers. Or if we don't have that, we can use aluminum foil to wrap around the tube immediately to prevent the minimum exposure to light. Now let's talk about the glucose tolerance test, which we test for high or low sugar in the body. And the administration of glucose is to determine how quickly it is cleared from the blood. Now the reasons, or some of the reasons for the test being ordered, is one, to check for glucose levels, checking for diabetes, insulin resistance, and a basic insulin overview of typically glucogen. Now, the test is usually used to test for diabetes and the things listed, and the glucose is most often given orally, so the common test is technically an oral glucose tolerance test, or an OGTT. And the test may be performed as part of a panel test, such as a comprehensive metabolic panel. And again, we evaluate body's ability to metabolize the glucose or the sugar. Now that is referred to usually typically as hyperglycemia or hypoglycemia. And hyper is the high and the hypo is the low. Think of it this way. When you give your children a lot of sugar, they become, we say, hyperactive. Well, hyper is high. So hyperglycemia is high sugar, while the hypo is low sugar. And if you can see, sometimes it requires certain things like no food or drinks 8 to 12 hours prior to the test. And then they drink the glucose, and the blood is tested 2 hours later. And of course, high glucose levels is potential for diabetes. So again, this is the glucose tolerance test. Now let's talk about the preparation and procedures. One is balanced meals. Now the doctor might request the patient to have a certain meal time cutoff, let's say nothing after 8 o'clock. And before that, maybe a balanced meal of certain types of foods to eat that they want the patient to do before they cut off the meal, or even afterward, what they can and cannot eat afterward. And typically, the water intake is also mentioned, that they might have a little bit of water or none. Now, typically, they're able to drink just a little bit or sips of water that will not harm the test at all if they're on an 8 to 12 hour fast. So water is usually typically good, just not cups of water, but sipping water is okay. Also, this might require an 8 or 12-hour fast, depends what the doctor's ordered. So again, follow the physician's protocol on preparation and procedures. And again, we want to make sure that there's no eating, there's also no smoking, no gum chewing, or caffeine of any kind, etc. If they're in an 8 to 12-hour fast, this is important because, again, this can change the results of the test. And of course, we draw the blood 2 hours after they drink the cola or the glucose cola you see on the screen. And typically it can be done also in intervals as well. And the other important thing is knowing when to stop the test. Now, typically we don't, as phlebotomists, stop any test. We need to get typically a doctor's permission to go ahead and cancel any test that we've done. Now, this might happen because after the patient has drinking the cola, they might get nauseous and even throw up, or feel sick to the stomach, and this might cause us to have to stop and put the test for a future date. But again, we need to contact the doctor and let them know the situation. Or after they drink the cola, they eat something or do something they're not supposed to do, that could also cause the test to be stopped and done for a future date. But again, we must also typically consult the physician, let them know that there's a problem with the test, and he will give the final say if we should stop the test, or he might want to continue and take the blood test anyway. So always consult the physician before canceling or stopping any glucose test. Now let's talk about blood cultures and why a doctor will order blood cultures. One reason is to check for septicemia. If a patient comes in with the symptoms of fever, chills, or tachycardia, the doctor will order blood cultures to determine if there is a bacterial infection that's circulating through the blood throughout the body. Now, if there's no symptoms, but the doctor suspects that there might be a bacterial infection, the doctor will check for bacteremia. And again, we might also check for an antibiotic sensitivity on the patients. This is what is used typically for blood cultures. Now, in doing so, we use 2 blood culture bottles, an aerobic and anaerobic. And typically these are timed tests. We might have to go back for a second set. So what you would do is you'd go in with the 2 bottles of aerobic and anaerobic and draw from a particular venipuncture site, and then come back 15-20 minutes later to collect another set from a different venipuncture site altogether. You will never draw from the same venipuncture site you did for the first initial blood cultures. And if you're drawing a neonate or an infant, you will use an aerobic bottle only. Unless the doctor suspects an anaerobic infection, you will use an aerobic bottle, and that usually comes with a pink top instead of a lavender or a red. And when you prep the site, you will use a ChlorPrep wipe, not an alcohol prep pad. A ChlorPrep wipe is used, and after you do that, you will never repalpate the site. And again, no repalpating after you use the ChlorPrep wipe for a blood culture collection. Now let's talk about therapeutic drug monitoring. Evaluate and manage medication therapy. Now, this is determined if the medication that the patient is on is too weak or too toxic for the patient. And also we do types of blood level checks, which is usually a trough level, when the drug level in blood is collected when the lowest serum concentration is expected. That is usually just before the next dose. And also peak levels. And this is usually 15 to 30 minutes after the medication has been given. The highest level of drug is expected at that time. Now let's talk about toxicology screening. This can be done with blood or urine. And we would measure legal and illegal substances through blood or urine. And of course, we have to make sure we take right preparations to do so. We need to get consent from the patient. Now, this can come also from a court order if the patient is suspected of something of an illegal activity, DUI, or some kind of accident that the police officer might have suspected the patient to be on some kind of drugs. We need a court order consent. We also need a chain of custody, and the said chain of custody form is added onto as the test specimen travels from person to person that gives complete accountability of a test sample, as well as a list of medications. So we also need a list of medications the patient might be on to determine outside of the legal or illegal substances and be able to measure that out. Thank you, and this is the end of special blood collection procedures brought to you by
All right, so you're probably thinking like, oh my God, what did she just show us? So what I want to do is just go, of course, back to the
Now, what
beginning.
would be the
Oh,
purpose of
sorry. Is go back to the beginning and just kind of talk about Billy Rubin. I know that he said a good bit of things, and you're probably like, okay, I'm waiting for you to say what I need to know, right? So just a little background with Billy Rubin. Billy Rubin does have to do with someone's liver. So if you do see Billy Rubin checked on your requisition or on your order sheet, depending on what your lab use, then again, it's not your job to know, ooh, what this patient have, or ooh, I'm nosy. I want to see, what's going on with this patient. Eventually, once you actually become more experienced, a lot of this stuff will be just a freak of nature. You're going to know. But just a little background, if you do see that someone does need a Billy Rubin level, basically the doctor is checking out their liver, and it's more than a hepatic panel. Remember that hepatic panel that can go in a SST tube? Well, Billy Rubin is more just getting straight to the point to actually check to see if someone does have a liver disease. So that's what the doctor would want. And so right now is using the picture of a baby that obviously has his or her eyes covered and is under a light. So I don't know if any one of you have experienced having any children or nieces, nephews, or grandchildren or whoever that may have had jaundice when they was a little baby. So typically that means that the liver basically is, how can I word it, needs to be a little bit more developed a little bit. So because of it, they come out the womb, maybe having a little bit of yellow skin, maybe the eyes are a little yellow. And for babies, it can be corrected. So with that being said, they'll have to go to the neonatal ICU, so to speak, and they will cover the baby's eyes and sit them under this Billy Rubin light that they would have to sit under for days. Of course, they take them out to take breaks and put them back under. So what it is that through the skin is penetrating to correct the liver issue that's going on as a newborn, okay? But as an adult or a younger child, if the doctor is actually doing a Billy Rubin level, then something the doctor is concerned about that they're wanting to test. So to kind of coincide, if you do have a Billy Rubin level, think about when a baby is young, they have to sit under a light to penetrate through their skin. But if you draw a Billy Rubin level in a blood tube, it needs to be protected from light. So this is the main important special collections when the reason why we've been talking about Billy Rubin is that to just give you a background. So obviously, it's oriented around the liver. But if you do draw a Billy Rubin level, it needs to be protected from light. So therefore, the biohazard bags that I showed you all on this weekend, you see how it's basically clear see-through, like straight up clear see-through. Then of course it have that little red box for the biohazard sign, but this particular blood would have to be put in a clear bag, but the whole bag is like an amber pink color. What that is it's a tint for the bag. So therefore, when the specimen is being transported, that tint on that bag is protecting it from any sunlight, any regular light. Because if it is in fact indeed, caught by the light, then of course, obviously you can only imagine the specimen can be damaged and it could be, not resulted in a way to give a Billy Rubin level. So Billy Rubin, what I would like you to make sure that you know that it does have something to do with the liver, but if all else fails, you need to know that Billy Rubin is protected from light. That's what I need you to circle. That's what I need you to remember, that Billy Rubin has minimal exposure to light. So in other words, it just needs to be protected from light. It doesn't need to be caught by the light, okay? Once you draw it, okay? Back in the day, they did used to use fall paper because fall paper obviously protects it from light and everything else. If you get hired a lab and y'all small functioning lab, and y'all probably like, ooh, we still do back in the Stone Age. We still use all paper to cover up, I don't know, you may work somewhere like that. Just know that if they are using some type of fall paper, just know that they're protecting that specimen from light. Okay, so but just keep that in mind. That's what I need you to remember about bilirubin. Okay, as a phlebotomist, you need to know that once you package it up and transport it, it needs to be protected from light. Now, next in the line of special collections, for those of you that had babies, you probably had this, not probably, but you had to have had this done in your pregnancy, probably 8 months or so, 7, 8 months or so. Now, not only pregnant people get this, it could be other people getting it where the doctor ordered this, but typically it is done in pregnancy. What this is, in a nutshell, cut short, it is a oral glucose tolerance test. If anything, you probably recognize glucose, which is another name for sugar. Okay, this is an oral glucose test. So not only will you be drawing blood to get someone's glucose level, but you are giving them something. That's what's special about this. So what it is that, this patient may be either a diabetic or, as a pregnant person that's not a diabetic. The doctor is trying to see, for the goodness of your baby, like, are you a diabetic while you're pregnant? Because you never know. So therefore, the pediatrician can know later on if your infant has could be on the list to possibly being a diabetic once they're born. So what it is that the doctor gives you these cola drinks that has flavoring. It could taste like Coca-Cola, it could taste like orange, it could taste like lemon, whatever. But what it is that it is a bottle. I don't really know exactly how many milliliters you're drinking, but you do have to drink that whole bottle. So as a phlebotomist, those are kept in your lab in the refrigerator. And if you get me as a patient and you see that, oh, Miss Chopin has a glucose tolerance test today, then you call me to the back, identify me. But in this case, you're not drawing my blood yet. You're just giving me the drink to drink. And you give me that drink to drink and I have to drink it all, then you let me sit. I don't go home. I stay in the lab. So if somebody has a glucose tolerance test, let's just say you have 3 on the list, you can kind of see, that maybe they're scheduled to come in. Then you're like, oh, okay, we're going to have a lab full of people, a waiting room full of people, because after they drink what they drink, they have to sit there for 2 hours. Then you call them back to the lab, identify them again, even though you did it. I know it's nerve-wracking, because it's nerve-wracking for me to even, like, I just told you that. But anyway, you identify them again, and then now you want to start preparing them as you should, and then to draw their blood. Because what this test is, as you see the word tolerance in there, this test is that the doctor wants to know how well your body can tolerate all this sugar in a short period of time, and see within a 2-hour time frame how much sugar your body was able to let go, okay, to evaporate, or basically how well your body tolerated that sugar and how much actually stayed in your body. Okay, so that's what you're doing. So that's what the reasons for this test being ordered is, to check for glucose. So maybe they're diabetic already, to see if they're insulin resistant. Again, you're not the doctor. You're not the one ordering the glucose tolerance test, but this is just to give you a background on why a doctor would order it. And the purpose for it is you are administering the glucose, you're giving it to me to drink, and then you are drawing my blood. Okay, now what's important about this test also is that they do need to be fasting, because if you can see that it kind of makes sense. You're giving them this sugar stuff to drink, but they need to not be eating, because it's also a glucose test. So what if they had like some kind of nut and butt cakes for breakfast, or what if they had some Fruit Loops for breakfast or whatever, and then they go and also do this glucose tolerance test where they're ingesting all this sugar. So we want to be sure that they have nothing to eat to drink from at least 8 to 12 hours or so, according to the doctor's wishes. Just know that it shouldn't be no less than 8 hours at any time that someone be fasting. Okay, so you also probably noticed the video said something about no chewing gum, no coffee, no smoking. I mean, you know, you probably like, God, we got to make sure that they did all that, you know. So you just need to ask them if they're fasting. But typically, if they currently chewing gum, you know, you just have them spit the gum out. I mean, it is what it is with that, but they definitely need to be fasting to where they had nothing to eat or drink. And coffee falls along those lines. A lot of people say, oh, I drink black coffee. You know, I drink decaf black coffee, but still, to be safe than sorry, no coffee. Okay, and with that being said, with the gum and the smoking, is that it's penetrating in their, you know, in their mucosa, in their cheeks, and so it's still penetrating in their skin or in their system, to where this needs to be a test that's non-fasting. But it's kind of going overboard. I mean, if someone had a cigarette smoke before they went, you know, a smoker, you can't tell them not to smoke, right? So they probably had a cigarette. They probably, you know, just tell them to empty it out. Just try to get as close to, you know, long as they didn't eat or drink. Now, you also heard them say you can have sips of water, which is true. When someone is fasting, they can have sips of water, but they can't have like, bottles of water. So if I actually had my last meal at 7 o'clock and I did sips of water until midnight, until I went to sleep, and I mean sips, it's okay. So if someone told you that they had sips of water, then, you know, just like, oh, okay, that's okay. Medication, good question, Miss Brianna. So the only time that a person is to not have medication is if the doctor ordered them to, but typically they can take their medication as ordered because they can just follow it with a sip of water. Okay, so it depends. And sometimes doctors tell the patient, don't take your medicine that morning. Okay, so it's up to the patient and the doctor, but it's not up to you to say, okay, did you take your medicine this morning? That's something that the doctor and the patient can work out. But that is a good question, but nothing to eat or drink. Okay. When I move it forward, it shows you the pictures of these sugary drinks. And it look just like this, okay? Like I said, it'll come with flavoring. They nasty, you know, it'll come with flavoring. So like he said, if somebody, you know, say, oh, I got to throw up because they drunk it too fast, you know, you just use it as your, you know, you just do the best that you can, use your judgment. You are not yourself supposed to make the ultimate call. Oh, we stopping this, we can't do this. Then as a lab, you guys have to call the doctor's office and let them know, okay, Miss Chopin, she threw up half of her thing. You know, what do you want us to do? You know, and typically they may say, have her come back the next day, but just know that you guys have to communicate with the doctor's office, okay? That you have to communicate with the doctor's office. And this is just reiterating that, you know, the patient needs to be fasting. The water intake that they are allowed to have is sips of water. They need to avoid chewing gum or caffeine. So also, once they're waiting for that 2 hours, what if I say, oh, you know, Miss Thibodeau, can I chew gum? You have some gum, or can I chew gum while I'm waiting 2 hours? No, they can't have coffee. They can't chew gum. They should not go on the smoke break within those 2 hours, because what it is that after they already drunk the drink, they're literally waiting 2 hours to see how well the body tolerated it, period. So they don't need any type of interference, no gum, no coffee, nothing, until after the blood was drawn. Once the blood was drawn, they can go to IHOP, eat all the international pancakes that they want. They can go to Waffle House. They can go ahead and have all their packs of cigarettes. I mean, while they're pregnant, they shouldn't be smoking, so I shouldn't have used that. But if it is someone else that's not pregnant, because like I said, it is other people, other patients that will have a glucose tolerance test other than being pregnant. But that is the purpose of the test, is the doctor's trying to see how much sugar your body can get rid of within a 2 hour period, okay? And if the levels are a certain amount, then the doctor will probably slap a diagnosis on your patient because they were not able to clear out this sugar within the 2 hours, okay? When to stop the test, like I said, you consult your supervisor, and then your supervisor will probably call the doctor's office or the clinic, okay? Now, moving forward to the next area that it talked about, and it talked about our infamous blood cultures that we already kind of been talking about already. So remember that if the doctor ordered blood cultures, it's always 2 bottles, anaerobic and anaerobic. He did mention, though, if you do draw blood on a pediatric patient, they only get 1 bottle, and a pediatric bottle would be a pink top, but similar to the pink color of our blood tube. Okay, you will just grab that pediatric top and you draw your infant. But for the most part, you will have your two bottles for your adults. You also heard them say sometimes the doctor can order blood cultures times 2. So if the doctor ordered blood cultures times 2, that means that it's really 4 bottles you need. But you draw your first set of aerobic and anaerobic from one arm, and then you draw your second set from aerobic, using an aerobic and anaerobic bottle from a whole different site. The doctor is really trying to figure out, okay, what is going on with this, with this patient? I need to know if she has bacteria or if she has sepsis, meaning that whatever the bacteria is starting to affect someone's organs. So what I want you to remember, that the reason why a doctor is ordering a blood culture for septicemia and bacteremia, you will see that again, okay? They trying to see what bacteria lies in that blood, and they also trying to see, like, okay, are they septic? Like, is this trying to get to their organs? Because a medical light bulb is that if a person has an infection, or meaning they have bacteria lining their body for so long, then if it begins to be old, it can start affecting other parts of their body, and it can start affecting their organs. That's why it's very, very important to seek medical attention. Okay, so with that being said, septicemia, bacteremia, which is bacteria, and septicemia. We need 2 bottles. Now, you also heard him say, I've been waiting to say this for a long time. I just didn't want to confuse y'all. So remember, I don't know if you remember, but I did tell you there will be some cases where it's already known that you won't use alcohol on the site. And I think I've already mentioned that if the doctor orders an alcohol level, then you do not use an alcohol pad, a 70% isopropyl alcohol, to clean the site. I know that we do let it air dry, but because you are collecting an alcohol level, you just don't want to jeopardize any different levels in your patient's alcohol level. You don't want to add to it, okay? So with that being said, for an alcohol level and for a blood culture draw, you would clean my site with the chloroprep or chlorhexidine gluconate, okay? Let it dry and then clean my blood, okay? I mean, clean my, take my blood. With that being said, the tops that you see on these blood culture bottles, you will pop the top, and then it'll have the clear rubbery covering that we already see on our needles that we tie our holder to. That's where you would put your transfer device so the blood can go inside the tube. Now, once you pop that top, you can wipe that with alcohol to clean it so it can be clean. But as far as the site, you need to use chloroprep or chlorhexidine gluconate, okay? So the most important things to remember about your blood cultures, we already know that they're first in the order of draw if they're ordered. Pay attention to if the doctor say blood culture times 1 or blood culture times 2. If the doctor say blood culture times 1, then all you need is your 2 bottles. If the doctor say blood culture times 2, then you would need your 4 bottles, but you draw them from different sites. Typically, you guys, you will see a lot of blood cultures orders if you are a phlebotomist in the hospital. You know, you go to the ER, or you go, you know, on your whatever floor that you're assigned to, you would definitely see blood cultures, because by this time, someone is already most likely so ill that they're at the hospital, whether they're in emergency room or urgent care, or, you know, minor care, or admitted in a hospital. That's where you will see these blood culture tubes. But just know that the doctor is checking for septicemia or bacteremia or both. And you use both bottles at all times unless you're working on a pediatric unit. You use the ChlorPrep wipe to wipe the skin to collect the culture. Okay. Do I have any questions regarding that blood culture? All right, so now we get into therapeutic drug monitoring, guys. I'm gonna go over the very basic explanation as possible. This could be that we have a mental patient, you know, let's just say you're working at Baptist psychiatric unit over there down the street from the our training location. It's many medications that they're probably on. I don't know if you've ever come across anyone in real life, you know, that say, oh, my doctor's trying to get me on the right medicines, excuse my mood swing, or you may say, talk about somebody like, oh Lord, the doctor needs to change their medicine, you know, they bipolar for real or something, you know, how you know, sometimes we talk. So with that being said, a person will be under therapeutic drug monitoring because the doctor is trying to find a therapeutic range for this patient. Rather it is some strong antibiotics, or rather it is mental medication. For example, lithium is the most common behavior type of mental medication that a doctor can prescribe someone that can have the patient up and down. So with that being said, the doctor would often get you to draw their blood because to try to see if the medicine is too weak or if it's in fact too toxic. So they'll have to come down on the dose, or probably tell them not to take it for 2 days and then go back and give them a smaller dose. So I'm saying all of this to say is that you see where you have too weak, then you have too toxic. Well, the types of blood levels will either be, you will be drawn as a phlebotomist, you will be drawing a trough level, or you will be drawing a peak level. What that is that a trough level is done before the patient takes his medication. So that means that if you're writing down trough level, then write 2 week alongside of it, because that'll help you to remember that if you do have a trough level, then that means that you're taking it before the patient takes his medication. Because the doctor is trying to say, okay, at its weakest moment before taking the medication, we want to see what the level like. So therefore, if you have an order to take the patient's peak level, that peak level is taken after the medication is given. So it'll either tell us that it's normal range, or if it's too much, meaning it's too toxic. So what I want you to gain out of the therapeutic drug monitoring special collections is that you will most likely in a hospital be drawing trough levels and peak levels. Trough levels is before the medication. Peak level is after the medication, because the doctor is trying to see, okay, at its peakest level, what the levels are for this medication. And so it will tell the doctor, okay, this vancomycin antibiotic is working well, or this lithium level is working well for her, okay, because her stability of her mood has been well. She hasn't had any triggers of bipolarism, you know, in a week. Okay, so just keep that in mind. You know, if this even helps you guys even realize the in-depth of healthcare, you know, like what doctors do, what you do, what you will be doing as far as drawing blood. You're giving the doctors understanding of what's going on in our body. If anything, you're starting to understand like, dang, our body do, you know, it's a lot of stuff that's going on. So just know that medical is, you know, is a big range. That's why medical field, you will always have a job. It's always medical out there. So just know that it's very important, and it's always medical research being done. So medical things will change, and they'll say, okay, let's not do trough levels no more, you know, on the first dose. Let's do trough levels after the patient have took her medication for 3 days, and we'll do a trough level before her third dose, so we can really see how it's working. So just to kind of let you know, trough and peak levels. Trough is before the medication and peak level is after the medication, okay? That's how the doctor know, like, how is it working for you? You know, oh, it's too much, you know, or the doctor will also be able to know like, oh, shoot, her levels are low and she's been on it for a week. She's not taking her medicine, you know. Some people hide from wanting to take their medicine. So it'll tell the doctor a lot, okay? So moving forward, last but not least, we talk about toxicology here. Remember, we mentioned toxicology a little bit in our medical terminology. This is just meaning that the toxicology department is the study of toxicology. It's the study of toxins. Ology means the study of. So with this being said, toxicology, we already know is toxins, means too much. Anything that's too much is bad for us, right? Typically, that's what they say. So with that being said, you can test someone's blood, you can test someone's urine. What I want you to get out of the toxicology screening is that somebody can legally get in trouble. For example, there's drunk drivers, DWI, you know, driving while intoxicated, driving under the influence of something. And you get stopped over by the cop. Let's just say something happened traumatically where it involved in a fatality of something happening. And so now you're going to court, or someone is going to court, and smack, the judge ordered you to have drug tests done every so often. The judge ordered you to have drug tests done every so often. Let's just say your husband, you and your wife, or you and your husband are going through this bad custody battle or divorce. And so now the judge has ordered, how can I word it? Let's just say you're going through a divorce and one of you say, oh, that child not mine, you know, I'm just saying a more Reprobish type moment. And the judge orders a paternity test. Let's just say you're going through a family history, you know, family tree, and, you know, you have a millionaire person in your family that obviously is on their sick bed, and they didn't put everybody in their will. And then all of a sudden this one person come and say, well, I'm a granddaughter, you know, I've just been away, you know, so now y'all dealing with legal issues because it's lawyers involved. So now you have to go to court. And so the judge has ordered DNA testing, you know, to see like if you really in this family line. I said all of that to say those 4 tests, alcohol, drug, paternity, and DNA tests, if it is ordered by the courts, then we need what this call is, not only a consent, but we need a chain of custody form. Okay, what that means is it was ordered by the court, it was ordered by the judge. So everybody who touched my sample, okay, everybody that touched my sample, whether it's urine or blood, needs to sign and date that chain of custody form, because this proves that if it's any faulty things that go on with that specimen, then we have a list of who hands, how many people or who touched it. So for example, I come in to you first with your as your patient, and then you drew my blood. So therefore, Miss Brianna, you sign it first. You drew my blood. Let's just say, Miss Tia, you were the one to package the blood. You still need to sign the sheet, the chain of custody form. Let me just say it correctly. And let's just say, Mr. Keys, you're the one that come and pick up the specimen to take it to the big lab at Baptist or take it to the Quest or wherever. You have to sign a sheet because you touched the bag with the specimen. And let's just say, Miss Diamond, finally, Mr. Keys give you the specimen so you can take it to the medical lab technician so they can start handling the specimen. You still sign that form, and the medical lab technician still signs that form. I said all that to say is that everybody who touches that specimen needs to sign the chain of custody form. So if it's ordered by the courts, it will be, not only will you have your requisition, because of course it was ordered by the court, a medical court doctor, and you have your requisition, you get your patient's consent because the patient needs to know. Don't forget this was court ordered, okay? Then you need your chain of custody form. So you have all of this with your specimens. Excuse me. And it talks about a list of medications because on the chain of custody form, you would actually have to write what other medications you could be tested, because you can only imagine that if something happened, and let's just say you get into an accident and they slap DWI on you, and you like, well, I haven't even took nothing. I don't even know how this happened. I don't know what I did, but you could really be on some prescribed medications that for whatever reason caused you to be under the influence of something, but it was prescribed by a doctor. So fairly, the courts need to know, like, wait a minute, Miss Chopin, she didn't take nothing, illegal. It's all ordered to her, So the courts would need to know that. The judge would need to know that. So I said all that to say, I don't know why they named it chain of custody, but it is called a chain of custody form. And following the chain, whoever touches that sample needs to sign that form. You're probably thinking like, oh, well, so we need to do that for every paternity, drug, alcohol, or DNA. So if it wasn't ordered by the judge, no, it's not going to be accompanied by a chain of custody. And matter of fact, the chain of custody is given from the courts give it to the patient. Okay. So with that being said, my son could be going off to college. There is some kind of money out there that they give, a grant money. Like if you have some kind of Indian blood, I don't even, I can't say it appropriately, but just for an example. So if I tell my son like, oh, we need to see, because, Big Mama, she was like half Indian. We probably got, that blood down in our line. So we go to the doctor, and then the doctor orders a DNA test. Well, that's just a simple regular order. It wasn't ordered by the courts. So I just need you to know that if it's ordered by the courts, then it needs to be followed with a chain of custody form. But if it's ordered by the courts, most likely it's going to be only one of the four: DNA test, paternity test, alcohol test, and drug test. It's only going to be those four. But if it's ordered by the courts, it needs to be accompanied by a chain of custody, and it goes to the toxicology lab. Okay, I'm gonna unshare my screen and put my whiteboard that I have. Oh, it's 8:24. I didn't know. I'm almost finished. Hold on. Just to kind of give you a little time if you need to screenshot it or take a picture. But basically, I should have had this up, but I just wanted to visually show the video clippings while I talked about it. But this is just a little bit about what I already went over. And if you want to document, like right here, DNA, paternity, alcohol, and drug, that will be a part of the chain of custody test if the doctor ordered it. Chain of custody form, legally ordered through the court system. DNA, paternity, alcohol, and drug. So a doctor can order a drug test. A doctor can order alcohol test. A doctor can even order a paternity test, but at that, or DNA test regularly. And that's fine. You'll draw the blood, look on the requisition, it'll tell you, what tube to go in. But if you see a chain of custody form, then you would know that, oh, this ordered by the courts. I wonder what she did, but just know the difference, okay? For example, if I'm not mistaken, like if you're going through a child support battle, typically, a lot of times that's ordered through the courts because the man or the woman want a paternity test before they even start paying, child support. So typically that is a most common chain of custody type thing, as far as that's concerned, if the paternity test was ordered through the courts. Okay, remember, trough is before the medication, peak is after the medication. Remember, blood culture ×1 is still 2 bottles, and it consists of aerobic, anaerobic. Aerobic is with oxygen, anaerobic is without oxygen. Remember, oral tolerance, glucose tolerance test. And remember, it's going to also, glucose tolerance test, when you see the initials of capital GTT, that's what that means, glucose tolerance test. We need to be fasting 8 to 12 hours. They need to drink the glucose drink. We draw their blood 2 hours afterwards, and drinking your, I must have typed that wrong. But anyway, drinking, after you drink the drink, then you draw the blood 2 hours after. Okay. And then after the blood is drawn, then the patient can go ahead and leave, eat, do whatever he or she, because it could be a he, that the doctor ordered it on. Remember, on ice labs is ammonia, lactic acid, ABGs. I left ABGs silent. I'm gonna talk about that on Saturday. Okay, I won't forget because it's a part of my lecture when we talk about on Saturday. But the ones that you protect from light is bilirubin, is what you will see most often, but most vitamin levels is also protected from light. But most common, what you will be tested on your national exam is bilirubin. Know that it's protected from light. Okay. I know we went over a lot today. I went over the order of draw more, and also special collections. Okay. So on Saturday, I will start off with a Kahoot game, kind of like, get us relaxed a little bit. Then I will go over processing your labs, because now we went over venipuncture, we went over how to read the requisition, we went over taking our patient blood. We also just went over how to collect blood and specimens in a special way. Now you need to know how to process it, which, is just simple, putting it in the biohazard bag, reading the requisition, putting the requisition. So we'll do that. Then after we do that, we'll get into our live blood draws for majority of the day. I will have 2 former students come in to get more practice. Be sure you guys hydrate on Friday night, Saturday morning, just so we won't have an issue. But again, we're not trying to traumatize each other. I will still, in my way, feel for everyone's veins, so I could be sure, like, okay, we got some veins, and kind of help your person who's going to draw blood, kind of direct. So just be well. And this is my participation moment. How well you do, how well I feel like you caught on to the procedure, how well I feel like you're ready. Remember, no one is going to be perfect. I just need to see that you understand the technique. I need to see that you're working towards being successful. And then after that, I'll be able to determine your take-home kits for more practice. Okay. So typically everyone should at least get to do venipuncture at least 3 times. And that's enough of what I need to see. And you can only imagine from what we did with the mannequins is that the more that you actually get your opportunity to do your venipuncture, then you'll get better the second time. The third time you get even better. Okay, so that's what I need to see in order for you guys to be well ready for your take-home kits. So after the class, you'll be able to practice on someone at home. For the the most part, but that's about it. So I will see you all on Saturday for 10 a.m. Let me know if you have any questions. I will send the next quiz tomorrow, and the whole quiz will be the order of draw. Okay. So do I have any questions this evening? This 2 hours went by fast, but I got over everything that I wanted to get over. So if no one else have any questions, then